In the world's efforts to prevent massive death and suffering, PSR plays a special role. We rally U.S. health professionals to prevent nuclear war, other nuclear disasters, and global warming. Ours is an ambitious undertaking aimed at some of the world's most menacing problems. With our focus on health professionals, we apply a pretty unique strategy. If we haven't succeeded yet, it's largely because the problems we face are massive and entrenched. But I would argue we weaken our efforts by not adequately applying our own strategy. We haven't yet reached and rallied enough health professionals. Imagine what it would look like if we did that successfully. Imagine how our work might take off if we reached, educated, and recruited huge numbers of health professionals across the country. Maybe you would hear a PSR message every time you visited your doctor. Maybe you'd see a PSR poster every time you walked into a hospital lobby. Or hear about the policy steps necessary to solve PSR's big issues each time you spoke to a public health professional. Maybe doctors and nurses would be lobbying Congress with us and on our behalf every month. Okay, that's an ambitious vision. Maybe it should be our 20-year goal. But here's the simple truth. If we really want to raise the medical voice effectively, we need more health professionals participating in our work. Activating more health professionals is how we build our strength. It's how we make ourselves more fully and effectively the organization that is uniquely PSR. Unfortunately, I don't see us prioritizing that kind of growth as an organization. We don't spend much time internally sharing our thoughts on how we can recruit large numbers of health professionals, or perhaps the right health professionals. I certainly haven't heard about a push to have each department integrate outreach to health professionals into our ongoing work. We haven't set organization-wide goals for health professional recruitment, and we certainly haven't required that all departments dedicate time and energy to that goal. So it's no surprise that our recruitment numbers are low. There are lots of strategies that would help us bring those numbers up. Here are a few. What if we focus on bringing in notable academics, well-known health experts whose voices matter on the issues of global warming, nuclear disarmament, and stopping nuclear power? We know who those experts are. Why don't we set a goal of recruiting, say, 9 notable experts every year? Once we set that goal, we would need to set a work plan. Target those outstanding figures whose voices would amplify our own, figuring out who in our network knows them and could effectively invite them to join. Place them on an advisory board so the whole world can see that they're working with PSR, and figure out a way how each of them can support our work actively at least once a year. What about focusing on multipliers? We talk about reaching out to the American Medical Association, American Nurses Association, American Public Health Association, and similar organizations of health professionals. And sometimes some of our departments do that work. Why don't we make that work a national PSR goal? Let's put some real resources into making it happen. Let's make top-level decisions on what we want those organizations to do, whether it's to endorse a PSR campaign, co-author a study with us, or put their own members to work on the issues that we address. Let's set specific targets and objectives, engage our top people, our executive director and our board, in carrying them out, and evaluate our successes each year if we really want to make progress. Maybe what we need is more visibility in the medical world. What's the best strategy for doing that? I don't really know. Should each PSR department be required to make an educational presentation at a major medical conference each year? Should we focus on having the PSR executive director and board place articles in major medical journals, as Mike McCauley did recently? Should we be placing paid ads in magazines that health professionals read? Or providing doctors with PSR posters they can hang in their waiting rooms? Whatever we do, we need to make a plan, commit the organization to it, and raise money to make it happen. I don't know. Maybe we want to start small. Maybe we should produce a packet of resources that our chapters can use in recruiting health professionals and provide our chapters with a structured training on how to use that packet. Maybe design a campaign where we ask each of PSR's 50,000 members to invite their family doctor to join PSR. Or maybe we should provide the health professionals already in our network with prescription pads with information they can give to their patients about PSR's work. You know, as your doctor, I recommend these 7 steps to help save the planet, so that the doctors, nurses, and other health professionals already part of PSR can more easily promote the organization. There are lots of ways we can become more fully what our name says, physicians and other health professionals for social responsibility. What we have to do first is to agree that concentrated recruitment is a key piece of strengthening PSR's identity and impact. If we agree to that, then we need to create an organization-wide plan, commit to it, raise funds for it, develop the necessary materials, and make carrying it out an organizational priority. That's how we make PSR better at being who we are.